This is a presentation on the nature of policy practice in social work. It is a brief introduction to this concept and this aspect of practice for the social worker. I'm Reggie York. At the completion of this presentation, you will be able to first define the concept of policy practice in social work. What is it? What does it look like? How do we do it? Number two, explain why social workers should engage in policy practice. Number three, identify some of the parts of the code of ethics that can guide policy practice. Four, identify some of the aspects of one theory about change that can be a guide for policy practice. Our first question is, what is your view of policy practice? What does it mean to you? Does policy practice refer to actions taken in behalf of a single client to make a policy work, such as, for example, getting an exception to a policy for this particular client? I would say no. Policy practice is not about working with individual clients. That's really what clinical practice is all about. Does policy practice refer to guides for actions that deal with groups of people? Yes, that's really the essence of policy practice. We're talking about groups of people where a certain guide is appropriate for that group of people. What is policy practice? Let's talk about policies that prescribe courses of actions. Social policies relate to the welfare of humans or human conditions. So we need to talk about what is policy first. That is what policy is. Policy practice in social work entails the use of social work skills to propose and change policies in order to enhance the lives of groups of people in need, including actions related to social and economic justice. You might want to stop and look at that and think about it and pause and reflect on it. It entails both policy formulation and policy advocacy. You first have to formulate a policy, then you will, of course, need to advocate for it. Those are two key parts of policy practice. Why should we do policy practice? How about social and economic justice? One of the reasons. How about improvement in the effectiveness of human services in the organization, making them more effective than they were? That's also a part of policy practice. How about improvement in the ethical behavior of social institutions? Yes. What if your institution is covering up some kind of scandal, something that they did wrong, and they're not doing anything to change anything? You might need to advocate for some kind of change in their ethical behavior. We have ethical obligations to engage in policy practice. That's another reason why we should do this. Where does policy practice take place? Does it take place in the organization? I would say yes. Organizations have programs and policies that guide their actions of various kinds. So policy practice can take place in the organization. Can it take place sometimes in the community, the local, state, and national? Yes, I would say sometimes it takes place. So it takes place on the organizational level, the state level, the national level, and so forth. Let's talk a little bit about policy practice at the organizational level. Engaging in organizational problem solving and decision making in order to improve the organization's response to human need is one of the ways that policy practice is implemented at the organizational level. Sometimes organizations have problems they need to address in order to be more effective, and you go through a problem-solving process in order to improve decision-making. Designing new programs or improving programs through various activities, including grant writing, another example of policy practice. You may have examples to think about in this regard. How about this one? Monitoring organizational actions in regard to accepted policies and advocating for appropriate implementation. So sometimes what you need to do is make sure that good policies the organization has are effectively being implemented. That can be a part of policy practice. You may want to think about things you might do or might have done to make that happen. Policy practice at the community level, social problem analysis that leads to insights about how to improve human functioning and enhance social and economic justice is one of the things you would do. What are the causes of child abuse, for example, which may lead to insight about what kinds of services might be offered to prevent child abuse. Formulating social policies, when you're talking about, say, child abuse, and you're trying to develop some kind of change in the law about child abuse, you would, of course, need to formulate a policy that can take a lot of discussion, a lot of different groups, and some research and so forth to come up with the best policy. And of course, then there is advocating for decisions, laws, rules, etc., that implement recommended policies. Actions should include writing to legislators, testifying at public hearings, and various lobbying efforts. Ethics as a guide for policy practice. A major source of guidance on ethics is the Code of Ethics of the National Association of Social Workers. Here is a statement. If you hit the pause button and read that and then come back to me. You can see from this, generally we're talking about the well-being of people with a particular emphasis upon those who are vulnerable, oppressed, and living in poverty. So social work does not identify itself as being primarily to help wealthy people, and so forth, get better. It's mostly for those who are vulnerable, oppressed, and living in poverty. Social workers challenge social injustice. Hit the pause button and read this statement. So you can see here, it is our ethical obligation, according to this code, to engage in activities that reduce oppression and so forth, and improve human functioning, particularly of vulnerable populations. So monitoring, practice, and actions. Here is a quote from the Code of Ethics again. Social workers should monitor and evaluate policies, the implementation of programs, and practice interventions. How effective are the services of your organization? Do you have any evidence that they are effective? Do you have some ideas about how to make them more effective? Those are some of the kinds of questions you may want to address. Well, I want to talk briefly here about diffusion of innovation theory as a guide for policy practice. There are numerous theories of social change that can be useful as a guide for policy practice. The one discussed in this presentation is diffusion of innovation theory. According to Roger Clark, there are 5 stages of adaptation of an innovation, 5 important characteristics of an innovation, 3 important roles that need to be played, and 7 change agent functions. So we have here stages, characteristics, roles, and functions. Those are some of the things that are part of Clark's perspective on diffusion of innovation theory. We will discuss in this presentation just the ones that have to deal with characteristics and roles, because I think those are the most useful for policy practice and social work. Here is a list of the characteristics of innovations. 1, the advantage of the innovation. What advantage does this have? You need to be clear on that. 2nd, the compatibility of the innovation with existing values, past experiences, and so forth. Number 3, complexity. Is it easy to use? That's also important. 4, can it be implemented on a trial basis so that we don't invest too much of our resources before we know it doesn't work? Are the results visible? Those are important things to consider. Important roles: opinion leaders who has informal influence, change agents who will lead, change aides who has most contact with the primary system. Excuse me, let me go back to that one. Look over this list and think about these kinds of things and how they might be, one or more of these might be played out in a particular effort on your part to get an innovation implemented. So here's a summary of the nature of policy practice for this brief presentation. Policy practice is about changing systems to improve the functioning of groups of individuals, not just one person. Social workers have an ethical obligation to engage in policy practice, which has the outcomes of improving service effectiveness, improving social justice, and improving ethical practice. Social workers engage in policy practice in various contexts, including the organization and the political systems in which we live. Policy practice can be guided by ethics and theories of change, among other things. This is the end of my presentation. I hope it was helpful for you.